family station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, good afternoon, everybody. It's Dane hanging out with you on Bobo 103.1 FM. And welcome back to the show. This is done weekly by HSA, who is our special sponsor. Goes for an hour long, and of course, right after is the BBC. So if you have any questions for any of our guests today, just please feel free to use our social media handle at Bobo 103.1 FM. You can send us a message there, and we will direct those questions to any one of our guests that you want to direct the questions to. I know in the past, even though we do tend to, I feel, get into every single question and every detail of the department or the event that may be taking place or the specialty that may be discussed over the airwaves, there are still questions that even as human beings we don't think about. So please bear with us, and also don't be afraid to send that message through to our Instagram page at Bobo 103.1 FM. What I can do is also have the guests offer their email address, their number, or their contact information, if that's even helpful also. Arm Against Cancer, HPV Vaccination campaign takes place on September 1st till October 31st. And I'm going to have the guests introduce themselves. A lot you will know. Some may be new to the airwaves, but we're going to have them introduce themselves, starting with ladies first. And you can start in any order. You can say your name and your title and how long you've been with the institution that you are representing today.
Hi, good afternoon. My name is Carvell Bailey, public health nurse, school health coordinator from the Health Services Authority, and I've been in this position for the past 10 years.
I'm Dr. Sarah Cuff, and I'm a general practitioner and the medical director at 7 Mile Medical Clinic. I've been back working there for the last 9 years, and I'm delighted to have partnered with this program.
And I'm Nick Gent. I'm the Chief Medical Officer, and I'm just coming to the end of my 3-year contract with the Cayman Islands government.
You think you're going to get re-signed? The contract is extended?
The granddaughters have had the final say on that one, I'm afraid. So no, I disappear at the end of next month. Very happy time here, but it's time to retire. The third time I've tried to retire. So
yeah, that's why I asked the question.
Yeah,
because
my wife's not holding out hope it will be, but yeah, it's time to retire and be a good grandparent.
I haven't been the first, obviously, to say this. I'm pretty sure your colleague and other partners have said this to you, but job well done and definitely well deserved. Your retirement is definitely needed, but we were hoping that we got you at least a fourth time again. But it's good to have you back in the studio. And of course, the next legend here in the studios.
Unfortunately, I'm not retiring anytime soon. My name is Dave O'Driscoll, and I'm the head of operations with the Cayman Islands Cancer Society. I've been working with them either as an operations manager, on the board, or running Movember for the past 6 years.
Love it. Yeah, he's done a lot of stuff here at this rate, but not only this media house, but so many different entities across the island. And it doesn't really matter how much times you've come in to the radio station, Dave. I think it's what you do outside.
That they still let me through the doors.
Yeah. You're a hard worker, and we have a lot of respect for you. But this table is full of hard workers, and I think one of the discussions that we're going to have today is a very important one. We're discussing Arm Against Cancer, but also HPV vaccination campaign is a big one. The first question I want to ask for the listeners is, what is HPV?
Okay. The HPV stands for human papillomavirus. It's a pretty ubiquitous virus, or more particularly group of viruses. There's an awful lot of them. And it's a virus that will infect many people. It's very, very prevalent. And certainly when people become sexually active, and enter that network of people where it's passed from person to person, there's a very high probability that you will be infected with this at some time in your life.
Oh, wow. Okay. Yeah, please explain more, because you said pass on. How is that passed on? Just for those.
It's passed on primarily through sexual intercourse, but all forms of sexual intercourse, so vaginal sexual intercourse, oral intercourse, anal intercourse, and between men having sex with men.
Yeah. It says, I noticed that the key words here, and I'll add to this, is HPV can be spread through skin-to-skin contact, and it's easy to contract. Very easy. Very,
very easy indeed. It's present in the mucous membrane, so contact between them. You don't need physical damage of the skin like you might with things like HIV, for instance, and hepatitis B. This is probably the most prevalent sexually transmitted infection that there is.
Let me ask you a question before we dig deeper into the seriousness of this. Obviously, this HPV that we're talking about. But let's just say, scenario, somebody obviously is told that they had this. They're not having a sexual relationship with anybody outside of their marriage or relationship. Let's just say something as simple as they went for lunch, they shared lunch with someone, because you said it's easy to contract, right? They share the same spoon, same meal.
Yep.
Is that a way that it happens?
It can do, but it's most efficiently transmitted through sexual contact. But we're not here to stigmatize people about it. We're here to be open. There is a rule of don't die of ignorance, don't die of shame. People have got to talk about these things and be clear why we need to do these things, when we need to do them, and what the benefits are.
Yeah, well said. What cancers, and this is the serious conversation around it, what cancers are linked to HPV?
We know that there are a multitude of cancers linked to the human papillomaviruses, the most common of which is talked about is certainly cervical cancer in women, but also there are other oral genital cancers involved, so anal cancer, penile cancer, vulval and vaginal cancer. But particularly, and this is relevant for our male listeners as well, we know head and neck and tonsillar cancers are on the rise. And the cervical cancer, or the Gardasil vaccine, has been extremely effective in reducing cases in women. But sadly, because we weren't originally vaccinating men, we've seen increasing numbers of head and neck cancers in that population. So we're really striving to make this something that appeals and is open for both our males and our females.
Yeah, thank you for that feedback. It's something I acknowledge here. I don't know if it's a Caribbean thing or it's a world thing. But I know when we use the word vaccination, especially after COVID-19, a lot of people tend to say, you know what, I've done that already since I was a child, and obviously through COVID, if not before, for obviously flu seasons and whatever else you're getting vaccinated for. But one of the things I find now is people, when they hear that, especially for things like this that you're talking about, they avoid that word. Nobody wants to get vaccinated. So I think one of the questions I want to ask is, how does the vaccination work, and how important is it? And do you find that people, like I did say, I don't have the stats, so I don't want to speak ignorant, but do you find that people avoid being vaccinated, and how important is it to be vaccinated for this?
People don't avoid being vaccinated. I think people like to talk about vaccines, and they like to discuss theories on social media of, the risk. But let's face it, vaccine technology has been around for hundreds of years. There are billions of vaccines given to people. There is no medicine in use today that has had such prevalent use that we know the safety profile of and we know the benefits of. Vaccines are one of the most important things of the public health movement. Very, very effective indeed. And the biggest problem we find, I've run immunization programs in the past in lots of different places, particularly where there's been low uptake. Generally, I find it's opportunity. If a vaccine's there, if there is a clinician who knows what they're talking about, and you have a sensible conversation with a patient or a parent, and you can offer the vaccine there and then, people take it up. But if it's difficult to get vaccinated, you've got to come back for the vaccine, you've got to book an appointment, whatever, then the immunization rates go down. But if the health services are open, the clinicians are skilled and know what they're talking about, immunization rates will be high.
Yeah. Anybody else have anything to add to that before I ask my next question?
I think just on a personal note, I had my HPV vaccine 18 years ago, and I'm pretty sure I'm absolutely fine and still alive and still thriving, and have had no negative ill effects from it. But also as a level outside of being a clinician, I'm a mum as well with 2 small children, and I have absolutely no doubts in my mind that this is something that I will be giving both my daughter and my son, because essentially I'm preventing them from getting cancer. What else can I do more effectively than this to prevent them from getting cancer?
And that, doctor, you brought up a good point, and that's why I wanted to kind of lead the conversation into around vaccination versus cancer. We all know the word. We've done numerous amount of interviews with Dave just on how triggering this is to a lot of people, because there's every single person, you either have a friend or a family that has been affected by cancer, but still the word vaccination is stronger in some sense, because they're like, okay, it's not just about social media anymore. I've actually seen doctors go against each other and says that would make statements to state, well, that vaccination is not safe, and this is the one that you should do because I've done heavy research on this. I mean, what do you guys have to say against that? And maybe that's what's creating some of the reason, the fear behind vaccination, because when you watch it, which is the most dangerous thing to ever do, turn on media and and say that's what you're going to count your life on, and what that media personality says, or what that doctor that seems to probably have his own agenda and opinion, right?
Yes, that's this is like a lot of what you're referring to now is the COVID vaccine, because it was something new, it was something rushed. It gave an opportunity for people to kind of throw their 2 cents in. Whereas with vaccines like this is the Gardasil 9 vaccine. Before that was Gardasil 4. When did Gardasil 4 come out? Like a long time ago. Like this has been around the block. It's been tried and tested. It's, one of the most researched and safest vaccines there are. And it is not something to be debated. It's not something new. Something that doctors or influencers can make a buck out of. Because there is an opportunity. There is even just a smidgen of doubt somewhere that they can latch onto. That's not the case here. It's something that's been around for a while. It's, as Dr. Cuff said, she got it 18 years ago, at least. And yeah, it's something that a doctor or a non-doctor can confidently give their children, without finding out later down the line that, oh, geez, we didn't know about this or we didn't know about that. No, everything's been tested rigorously.
Yeah. Okay. Any more to add on that? Thank you so much, Dave. Really appreciate that. That's well said.
And just to add, with the HPV vaccine, as Dave was saying, it is one of the proven vaccines to fight against cancer. So, why would you not want to put yourself in that power, to have that power to get something that would prevent a cancer from happening to you or your children? Yeah.
Yeah, well said. And this is highly recommended for young kids also, but I see a statement here that's saying, why is vaccine, this is a question that was asked, why is vaccinate children against HPV?
Well, the reason that we give it to children, we're actually giving it to people of an age before they're likely to start having sex. It's as simple as that. So we're getting the protection in there because, as we said at the beginning, the most effective way of transmitting virus is through sexual activity. So before children start experimenting or, becoming sexually active, that's the time to immunize them. So we do it then, but we don't restrict ourselves to that. We're certainly, we see as a priority group, any woman under the age of 25 who's not yet been immunized is in a high priority group. But we're also happy to immunize women up to the age of 45, not particularly useful after the age of 45. And we obviously want to give this vaccine to men who have sex with men as well.
I see a very, and thank you, by the way, but I see a very important question here. No parent would like to believe that their child is sexually active past the age of a certain age, right? But what are we talking about here, guys? What should we consider to say, okay, I am going to get my daughter or my son vaccinated from the day you realize a girl is pretty? Or vice versa. It's the same thing. I'm just putting a statement out there. I didn't know when my son was obviously drawn to women, because obviously he doesn't have those conversations. He does now, but I never knew when it happened for him. I always treated him like he was 2 or 5 years old in my head.
Sure, but you're also probably hoping you're going to be a grandfather as well. So, you know,
That part.
secretly at the back of your mind, you know that that's going to happen.
Yes.
We also cast ourselves back to when we were 14, 15 years old, and those thoughts were there. And it's, you know, sex is a very powerful drive. It's what keeps the human population, you know, as big as it is, and you know, the pleasure principle in sex is wired in there to make sure the species reproduces. You can't get away from that. And you've just got to be honest and say, okay, I don't want to think about this in my 13, 14-year-old son or daughter, but you're not thinking about it for then. You are thinking about get them protected now for later. And let later sort itself out.
Yeah. Yeah.
This is a community vaccine drive. So we have to think of the entire community, and when is it best to strike, as it were, is before sexual activity happens in any of the children in the community. You know, we can't just go, oh, well, when do you think your kid is going to start, messing around with the opposite sex? And you say, oh, maybe 16. Okay, well, we'll mark you down. So we'll come back to you when she's 15. You know. And we can't do that because it'll be a huge mess. Let's get everybody done one time, nice and early. And if we all comply, then we'll see the numbers drop drastically for years to come. It'll be amazing.
Yeah, but I think also the conversation has changed ever since social media, right? Because I mean, I'm in my 10-year-old WhatsApp group, and parents were talking about that. You know, Tim has a girlfriend now, like in class at year 5. So, and obviously you're listening to what social media is saying, and it's driving that to young kids. And now I'm thinking, do we have a conversation with our 9-year-old, a 10-year-old about getting this vaccine that early? Maybe I might be wild for thinking this way, but we're having a conversation. Like my 10-year-old is now looking at a young lady and saying, well, Dad, guess who's my girlfriend? What do you know about that? Like, you know, we're having it earlier and earlier these days. So yeah, I don't know. I think it's an important question for the parents.
I think you don't frame it just in the context of HPV. I think you frame it in the context of a good sex education. It's not just about protecting yourself from HPV. It's about protecting from a wider range of infections. It's about understanding about contraception. It's understanding about sex developing in a safe way, in a safe place. There's so many dimensions to this, and it can be difficult as a parent. Personally, I always let my wife speak to the boys. She's a farmer's daughter. Yeah. They're very practical and down to earth. But yeah, you've got to have the whole thing, and it's not one conversation. You can't get all of that information over at one time. It's about opportunities at times when people are receptive to talking about things. It's about your kids knowing that they can come and ask you difficult questions, and you will answer them honestly. Mm-hmm. And that can be difficult. Sometimes it's better to get, somebody who's professional at it, which is why it's good to have things like sex education in school settings, because you can get a professional educator who knows how to answer questions, is prepared for it and understands it. Sometimes it's better if the parents do it because there's that bond and that relationship between children. Sometimes it's the older brothers and sisters that, and sometimes it is friends, but it must be from a source that knows what they're talking about. And you get the problems when you get younger people talking to each other. They can evolve ideas and thoughts that are mistaken. And so there has to be a role for the older persons, and particularly the parents and teachers and healthcare staff.
I always thought it was sweet and adorable when I, was telling my kids that, the babies come from Santa. So they deliver it whenever he finds the time, not only in Christmas, but he works all around. But now I kind of feel like the only reason I brought that up was because it was difficult to have that conversation, like you said. Yeah. For a while I had my wife take it on, but, recently I've jumped in with the youngest one. And you know what? Once you do it, it kind of takes the nerves away right away. It's like ripping the Band-Aid off. And I would dare to say to any parent, have it as early as possible. Have it as early as you think that they're having those conversations already. They brought the hint up of what I said earlier, that, hey, Dad, this girl is my girlfriend, even doesn't see it in that context, doesn't understand what a girlfriend is, we can start to slowly have that conversation.
It's also a conversation about trust and respect, because I think a lot of us are quite worried that that relationships can be abusive, and not necessarily out of intent, but learnt from what they see as expectations that are thrown at them on the internet from some rather more reprehensible characters that trade on macho images and so on. And I think that's really important. It's about love, trust, protection, and ultimately setting an environment where people are safe and they can enjoy it themselves.
Yeah, well said. Guys, we're going to take a break soon, but before I go, I do want to, since we're on the tough conversation, is how many doses are we talking about when it comes to vaccinating a child or an adult?
Okay, so some good news. That's a good question. Some good news for parents and children. For this HPV Gardasil 9 vaccine for children, it's 1 dose. So that's good news for persons who are apprehensive about needles and stuff. Just 1 dose does it for persons under age 25.
I mean, how long is it that dose is this period? You just take
Just
it once,
one dose and that's it.
Okay.
Yeah.
Oh, wow. Wow. Good news for sure. And we're going to come back and talk more in this, unless anybody has any more feedback to any one of the questions that we have before we go to a break. I don't want to open the mic up for any feedback on any of the questions.
Well, I was just going to add to what Dr. Gent was talking about with the opportunities for talking to your kids. It's all fun, and people have a lot of good anecdotes and stories about what you tell your kids with the birds and the bees and Santa, and my one was we were all born from sausages. I think that's because I'm from Ireland, and we love a good sausage. But yeah, it's especially in this day and age now, fathers are becoming much more involved.
Yeah.
I know I am up to about 30% in terms of changing nappies compared to my wife's 70%. And that's some good numbers. That's some good numbers.
Very impressive.
Yeah, thank you. I'll take that. But also it's a good opportunity now for the father to, when he does have a conversation, to actually be factual, not try and think up something. And then when you have the next conversation, try and remember, geez, did I say the birds and the bees, or did I say Santa, or did I say the sausage?
Yeah.
You'll be proud of yourself for having frank conversations with them, and you may not even realize it, but when you are speaking the truth to your kid, they can recognize that, and they will look up to you more, and it will actually increase the bond that you have with your children.
Yeah.
This is a great opportunity.
Yeah, well said, Dave. I'm glad that you ended on that note. Thank you so much. We're going to take a quick commercial break, and when we come back, we'll dig deeper into this conversation around the vaccine and, of course, this whole initiative and the drive and the dates. We'll recap the dates for you again. We'll be right back.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
Welcome back to the show. It's Dane hanging out with you on Bobo 103.1 FM. My pleasure to continue every weekday, once a week at least, to do these special shows with HSA. We usually we talk about a special campaign that's going on, a special conference, or we may dig deep into a specialty from a certain doctor, or maybe there is a marketing initiative that they're trying to push at HSA to make you understand just more about what's happening, the promos. There's different things that's taking place at HSA. So we are so happy you decided to join us this afternoon, and we still want to take the pleasure to obviously introduce our guests again for the new listening audience. So what I'm going to have them do once again is just to introduce themselves and their titles very quickly this time, and we'll jump right back into, of course, discussion all around HPV vaccination.
Carvell Bailey, Public Health Nurse, School Health Coordinator, Health Services Authority.
Dr. Sarah Cuff, General Practitioner and Medical Director at 7 Mile Clinic, and delighted to be partnering with HSA on this important program.
Nick Gent, Chief Medical Officer.
Dave O'Driscoll, Head of Operations at the Cayman Islands Cancer Society.
It's a pleasure to have these experts in their field here in the studios today to talk about a very special initiative and a very important initiative, I should say. I think one of the questions I do want to ask again, just to recap, is what is HPV? We want to recap that and just how important is it to be vaccinated. And this is, guys, this is a quick summary if you want to, or if you want to elaborate more on it again, please feel free to, but do not feel like you have to give the full context you did before.
Okay, quickly, HPV stands for human papillomavirus. It's a virus that can infect the genitals, the anus, the mouth, and the throat. And it comes in many, many different varieties. There's a whole group of them. Two of them particularly, though, are really important in terms of potentially causing cancer.
And the vaccination that we're talking about is protecting us against the 9 most virulent strains that we know cause these types of cancers. And this initiative is offering the vaccine to those between 9 and 25, both girls and boys, to try and prevent against the spread of these cancers.
Love it. We heard earlier that obviously you're only going to need one vaccination. So if you're scared of needles like I am, you don't have to worry. Build up the strength and, of course, the confidence to go in there and get it done. And you only need it once in your lifetime. We heard the good doctor said earlier she got hers 18 years ago and still going strong. We know now, because you mentioned it before, that obviously it's not only for girls, because that was one of the questions. Is this vaccine only for girls? No, this is for both male and female, correct?
Yep, because if we're going to interrupt transmission, and remember that it's mostly sexual activity, and we need to make sure that boys and girls are protected, then they can't get infected, then they can't pass it on. So it protects people individually from these cancers, but it also protects the community by breaking down the spread of these viruses that cause these cancers.
Yeah, absolutely. And one thing we also do want to, because we were speaking about kids earlier, and just how to have the discussion around the vaccination, and how important it is, and when should we start having the discussion? I think the important question is, what age are we thinking here? How early should we get the vaccination for a child? Is it 8? Is it 7? Is it 9 or 10? What are we talking here?
It's the age at which they need to have the knowledge, at which they're receptive to the knowledge, and you're comfortable in having that bond between yourselves and your children, where you can have that open and frank discussion. There's no magic number to this. I mean, some children, particularly girls, you can give these messages to very, very early. Boys, sometimes they need a little bit more maturity. And and we know...
You said that with a straight face. I'm
But it's generally true.
Yeah.
Women tend to be a bit more responsible, a bit more sensible, and certainly so from a much younger age. I mean, boys at 15 are still children. Girls at 15 usually are women.
Yeah.
So you've got to know your audience.
Yes, absolutely. I'm still impressed in just how straight faced as you said that. You've been married for a while too.
I've been with my wife now 47 years.
Wow.
We've been married 40 of those years. Met in the first term at medical school, decided to get married after we'd finished, and so my first girlfriend when I was 18.
Congratulations. You know what I'm not only impressed with how long you said you've been with your wife, but I'm impressed that when you speak about her after 47 years, you have a little blush and a smile on your face.
I'm still in love. No problem with that.
I love it. That is definitely relationship goals right there. I love that. All right. So guys, what if there is going to be that there is going to be that individual in the car, and usually the percentage is very high on this. Do I really need this vaccine?
Yes.
Do I really need to get it? Is it going to be the end of the world if I don't get it?
Well, unless you're entering the clergy, maybe. But
and I'm not sure that's the perception these days.
But I'll accept no follow-up questions to that, by the way. No, this is community-wide. This is one of those things where it works best if we all do it together. They have done some great jobs in other countries, such as Australia and Sweden, for example, where they have it hasn't been a mandatory vaccine drive, but they've done such a powerful campaign, and like in a way kind of convinced so much of the population to do it that it is practically eradicated chances of cancers such as cervical cancer in that community for a long time.
Yeah.
So yes, it's what does it say? What's good for the goose is good for the gander?
Yeah, and when you say, would it be the end of the world? It might be the end of the world for somebody you love.
Yeah.
because you've not played your part in breaking that route of transmission. I said we've talked about all the other cancers, but let's just come back to the cervical cancer. This is one of the commonest cancers in middle-aged women, so from the late 20s up to the mid-40s. This is a cancer that affects women often when they've got young families. It's not a nice thing at a good time.
Yeah.
And it can be very, very upsetting for the whole family, not just the affected person. Just play your part.
Yeah. Complete different conversation. The reason I have a lot of respect for Dave, I don't think he really fully knows this too, by the way, but when I first got back into radio full time, I was against any type of checks when it comes to finding out if I potentially may have prostate cancer, right? I know I was reaching that 40 mark, and ever since I found out that this is something that runs in my family, from my granddad who passed away from it, my grandfather passed away from prostate cancer, my uncle got it and my dad did, but they got early detection. They checked it. Even then, when they were telling me the story, I was like, never. It's just not going to happen. And I just remember Dave coming into the studios constantly talking about it. Get your check. Now, passionate he was about it too, and serving with a purpose. I decided, literally crying with my wife while holding her hands, that it was time to get that check up. And, I always joke and say to people that I have a bromance with my doctor now, because I go in even when I don't have to get checked up. And he's like, you don't have to come this quick. And I was like, I like it. I want to. It's something I need to do. And the reason I brought that up is because of what you said. It may be the end of the world for a loved one.
Yeah.
I think that's when it became important to me, looking at my kids and wondering if I ever will get to hold my grandkids. I think that's the answer they want to hear. Is it the end of the world? Maybe not for you, but maybe for somebody else that's very close to you. So you got to be the first person to advocate it, right? So yeah, it's extremely important. Any feedback, guys, on that question? Any more feedbacks, or do we move on from there?
Well, you do come back to the men versus women bit again.
Yeah.
And the intelligence and pragmatism. Getting women to involved in screening programs is a lot easier than men. Men just do not do it. And it's sad, and it's really important. And it's not just the prostate, but it's the colorectal cancers. The three most important screening programs we really need to push, develop, and do some reform work for in the Cayman Islands is cervix, breast, and colorectal. But cervix, we've also got HPV. And, it'd be nice to think ahead that if we get this right, if we get high uptakes of HPV vaccine, in 20 years, the rate of occurrence of cervical cancer should have fallen by at least half. And in 30 years' time, we should have virtually eliminated it.
Wow.
And we won't even need to screen for it then.
Yeah.
And it's certainly possible that we're working on systems at the minute of introducing HPV testing as part of cervical screening. Therefore, and then cervical screening can be done on a far less frequent basis when we know people are HPV immunized and HPV free.
Yeah. Well said, Doctor. Thank you so much. And I think one of the things I want to add, I don't know if it's more directed towards Dave or maybe just parents in general. And all you guys are pretty much parents. What I do want to ask is, guys, you are right. I got it right. I did get it right. All right, good. Is how do you explain this to a child when you're telling them what they're fighting against here when they're going against this vaccine? I think that was one of the important questions. Dave, you've come in so many times and we've discussed this word cancer, but I don't think we've ever got to the point that we said, how do we speak to our kids about it? Did we ever have that conversation? Because when I think about it now, if something was to happen to me, how do I have that discussion with my kids that what cancer really means?
Well, yeah, most of the times that I'm in here, begging you to get yourself checked, I'm wearing my Movember hat, and I'm talking about a conversation which is just as hard to have, which is men talking to other men.
Yeah.
About getting themselves checked, getting their PSA tests recorded, finding their doctor, speaking to their GP, their family physician, about their screening schedule, and what's up next. Getting guys to talk to guys is just as hard as as talking to your kids.
Yeah.
But yeah, it shouldn't be. These are barriers that we are trying to break down, and day by day, and just breaking the stigma. And if everybody can have the confidence in this vaccine drive, which they should, because this is nothing new. This is something that is it's not revolutionary, it's evolutionary. This Gardasil 9, that we should have the confidence to talk about it, and therefore the confidence to take it.
Yeah. What about you, Dr. Sarah?
I think we have to speak to our children honestly. Cancer is common. There's no denying it. We're talking at around 1 in 3 people. Look around this room, or we can rock, paper, scissors it out, but it's common and somebody's going to get it. And so I think children probably younger than we anticipate also have an awareness of it. They know about their granny. They know about their mom's friend or their best friend's dad. It's common. And I think we just need to have those honest, maybe keep it simple, but those honest conversations about children. Don't shy away from the word. That's one of the most important things as a parent. Don't talk about it as an illness or a sickness, because then God forbid the next time they get an illness or a sickness, they're going to worry that they have this thing. So use the technical terms. You can keep it simple, but be honest with them. And then I think once you've started to have those conversations, then you can be positive about it. Hey, look, there's also this vaccine or there's this shot that we can give you that protects you against this.
Yeah. And Dr. Nick also.
Yeah, I mean, cancer is a whole new subject on itself. But it's very interesting to get with HPV something that's so tightly intertwined that, as part of that sex education, people have got to understand anatomy and have that explained to them, which brings you on to a natural point where you can explain that abnormal cells can form, and if they're not detected, they're not treated, that they can spread, they can interrupt the functions of other organs, and this, if you can't successfully treat it, will unfortunately lead to people dying younger than they should.
Yeah.
And I'm being very simple and straightforward about these things, and then you can come back to, but if you have the vaccine, that virus can't cause those cells to divide wrongly, so it can't cause a tumor. And you there's so much you can do there, teaching anatomy, biology, microbiology, immunology.
Yeah.
It doesn't stop. But cancer, again, it's another subject at all. And do remember that as we increase lifespan, cancers become more common, because most cancers, this is an exception, most cancers are a consequence of old age. And as we get successful at stopping people dying, firstly from infections, then from heart disease, cancer is the one that's waiting for you as you get to the end of your lifetime. And what we're also doing, but by moving cancers out, or by stopping them happening, or by treating them successfully. And I've been practicing medicine for over 40 years now, and I can tell you the difference in what I remember. A good example, practicing medicine in Liverpool, smoking rates sky high. I would see routinely every week, I would pick up opportunistically two lung cancers. And from the point of detecting a lung cancer to death would usually be 6-7 weeks then. Now with immunotherapies, checkpoint therapies, everything else, people have got years of good quality life. So the whole scene around cancer is changing. Our ability to detect, our ability to treat, and most importantly, with things like HPV vaccine, ability to stop them happening.
Yeah. So good. I really love this conversation. Nurse Carvell, I'm not going to leave you out. What's your feedback?
Okay. So just to add, I'd like to commend the parents, in the Cayman Islands, because I'm intimately working with the schools with the HPV program. And what we've realized, myself and the school nurses, when it's a vaccination clinic day or it's a vaccine day at school, the children would come well informed. The parents would have had some sort of conversation, so they would come and they would tell us what this vaccine is about and what it would prevent. And we feel encouraged by that, and we really want to commend the parents. They're doing a good job. They're going out and they're doing their research and they're informing their kids in their way, and we like that. Yeah. Whatever other myths they might have, we are there to clear it up and to encourage them. So the parents are doing a good job, and I just want to commend them.
And that's coming straight from someone that goes into the schools on a daily basis, right, and sees this. I'm glad that you touched on nurse communication, because sometimes this can be miscommunication or wrongful use of communication. And the reason I say that is because I, for one, had a lot of faith in parents, and I still do, and a lot of parents. But if you ever want to lose a little bit sometimes in what you think of how far a parent can go, I dare you to watch a Netflix documentary. I think it was titled, what is it called again? Unknown Number, the high school catfish, where a mom was catfishing her daughter and basically telling her the most awful things, all because she was trying to keep her away from a relationship. So she was bullying her daughter, cyberbullying her daughter. She was obviously arrested, and she caused so much heartache between so many different parents, kids, police. You go on, this went as far to the FBI. So I'm bringing this up. I promise you there's context. The reason I'm bringing this up is because I'm saying to myself, how do you address a parent today, anyone that wants to take it, that's going to say, well, this is what's going to happen if you have sex, if this is the weapon that they want to use to have their kids to not have sex? Because you have parents that are listening to this and use this as an advantage to say, oh, this is how I stop them from doing this, right?
We've certainly had people think that that's a good argument. It doesn't usually work. Children are usually brighter than you think they are, and they can see through the lie, and so making those misrepresentations just break down relationships between you and your children.
Yeah.
You know, trust and truth with children is so very, very important. But no, it doesn't cause any harmful side effects. It doesn't cause any serious illness in the long term. Children have a right to know all of the dimensions of the things that affect their lives, and that's the whole sex education as we're talking about it now. HPV being part of that, and I know that lots of parents will instinctively think, I would love, my son or my daughter to be entirely abstinent till the night of their marriage. But let's be realistic, folks. It doesn't work, and actually, the problem is when that is taught to people, or those expectations, it can end very badly, I'm afraid, because that's when you get things like the early unplanned pregnancies, and you get even more disruption between children and their parents.
I mean, the key word I used was weapon. It's more of a weapon than anything if you dare to do that and try to threaten your kids in that way, because they're going to do what they want to do at the end of the day if you're using it as, something for your entertainment, basically, or just for your purpose. Yeah. Like you're saying, you're not going to do this, and this is why you're not going to do it. That makes a kid explore a little bit more, I think. Guys, I want to thank you. I want to give you some positive feedback on putting together this campaign. It's a very important one. We want to kind of bring it back now to the Arm Against Cancer campaign. Just how long is this campaign going to be running for, and can you get them familiar again with the dates?
Well, the Arm Against Cancer campaign is running from September 1st to October 31st. So we are already underway, and the vaccine is available from your HSA, public health district centres, as well as HSA itself, and as well as many private clinics who are teaming up with this for this 2025 drive. That would include Cayman Clinic, Doctors Hospital, Health City Cayman Islands, Integra Healthcare, Savannah Medical Centre, 7 Mile Medical Centre, Cayman Doctors, Cayman Wellness and Medical Centre, Selamar Central Clinic, and the Strand Medical Centre. So you can just see, just by the uptake of private clinics, how much confidence is in this vaccine drive. And I hope that is passed on to the parents. So you just reach out to them. It'll book you in. There is a consent form, obviously, for all, for adults, for their children. And then come October 1st, we will be launching it in the schools as well. So you will have an opportunity to have your child vaccinated in the school.
Oh, wonderful. And this is offered, go ahead, nurse, sorry.
Thanks, Dave. And just to add, for the schools, we'll be starting on October 1st. So our parents can expect to receive communication from their schools with the online consent form that they would have to complete, that we can get the permission to have their children vaccinated. They'll also have an option to accompany the child on the day of the vaccination. When the nurses decide on the date, it will be communicated back to our parents. And also, they'll have a little treat because we have the Ministry of Health and Environment and Sustainability did a lovely presentation, a PowerPoint presentation with lots of information. And we have also included that in our package that will be coming home to the parents so they can get an overview of the HPV vaccine and the program as well.
Yes, and we've got a novel way of you registering. You can point your smartphone at a Q code and it will take you straight to the website to register and give consent for your child to be immunised. And we've just started that this year and we know already that that's hugely successful way. So no pieces of paper getting lost between the teacher to pupil, to take them home, to bring them back and so on. And when we were doing PTA meetings about this, we put the Q code up on people were getting their phones out, taking the Q code, already consenting their children.
Yeah.
Love it.
So we know there's enthusiasm for it, and it's another way of us taking the barriers out of it. I'd like to thank so much all of our partners. Previously, we've just done things through the HSA. Now we are covering, so we've got so many private sector partners that I expect we'll get extremely good coverage. And by the way, if you're on the sister islands, Little Cayman Clinic and Faith Hospital have these vaccines and can give you shots there as well.
Love it. And the vaccine is free, just to add again. I don't know if you guys said that before. Yeah, perfect. For parents that have their kids in private school, would this be offered to kids in private schools also?
Yes, it will be offered to all the schools. All the schools will be contacted. All the parents will be contacted, both government and private schools.
So they should receive an email.
Yes, they will. They will be receiving an email shortly if they haven't already.
Yeah, there aren't two universities of private school children and public school children. They do mix.
Yeah. For some reason, we seem to always be separated for some reason, right?
Yeah. So we've got to make sure that everybody on the islands is covered.
Yes, absolutely. Guys, for more information, I urge you, please take this one serious and get involved. Let's get the numbers up on this one, okay? Information can be found on the HPV vaccine, and the campaign can be found via the Public Health Department. You can call them at 244-2648 or 244-2889. And you can go on their website if you're happening to listen right now in your workplace and you happen to have a computer or your phone in front of you. You can just simply dial in hsa.ky/public-health/HPV. Once again, that's hsa.ky/public/health/HPV. All right. One question I do want to ask before we end our interview, it would be very rude of me not to ask. Dr. Nick, you have announced on the radio that you are not seeking to stay any longer because you want to spend some time with your wife, as well deserved, and your grandkids, and you deserve that. But I think one of the questions I do want to ask, you have been serving under the hospital HSA for a while now. What's one of your best memories that you can recap and tell us here on the airwaves? I want to steal that moment before somebody else takes it from you. Any media team, glory.
Probably too many. I mean, it's been a lovely place to work. I've valued the work that I've been doing and thoroughly enjoyed the work I've been doing. But the thing that makes Cayman is the people. Every day, even from that first week when my hire car was running out of petrol, and I got to the petrol station. And I couldn't work out how the pump worked because pumps in Cayman have got this extra lever that you don't see in Europe. And the petrol attendant came over and he said, "Are you having problems with that, CMO?" And he'd seen my picture in the paper, recognised it, And but yeah, I mean, just such lovely people. Very much reminds me of growing up in the north of England in the 1960s. Where people didn't lock the doors, they left tea and cake out in the back kitchen. So if somebody came round, they let themselves in, made themselves a cup of tea while they were waiting for you to come home. That community thing. People took food around to each other's house if somebody was unwell, and it's really taken me back to then.
Yeah, I love that. That was so well said. I mean, you could have named so many other different things, especially because of the department you work or the job title that you have. I'm sorry, but But I love how you automatically just left it at our people, because that's important. That's what Cayman is about.
What I'm going to miss.
Yeah. And it's like I said earlier, the people that serve the community too. That's what makes that impact.
I'm sure that when you move back home to England, you realize, oh no, what I missed was the weather. It was the weather.
Yeah, I'm going back from summer here to the start of winter, and the last few winters I was there, it got down to -8 degrees centigrade where I was living. Yeah. So yeah, that's not going to be fun.
Dave's right though. I think that's going to be one you think of.
I'm going to have to start wearing jumpers again. Yeah, jeepers!
And closed-toed shoes, CMO, because I know you're going to miss those sandals.
Yeah. I had an email. I wish I had it up, guys, that I'm going to share with you, because I realize when I go out now, a lot of medical students have told me that they personally listen to the show. So we do have a lot of medical students, future doctors, future nurses that are listening to this show constantly. And I get it now. I understand why they're doing it. But I like to help that young lady that saw me before. She sent a letter, and I'm going to try to get your email so I can send it to you guys. But she went to do the MCATs for her second time, and she failed it the second time, right? But it was because of a show like this that she was listening to a doctor that basically spoke. He was so passionate about how much he loved his job and just heavy research and what he had to go through. And he also had a story of failing the MCATs twice. And because of that, she took it back on again. Studied differently. She got, I think she got somebody to tutor her this time around and bounce questions with her family members. So this did different things. Yeah. And long story short, she's now passed her MCATs and now on to George Washington. She's heading off to that school. So I think it'll be very wrong of me if you guys didn't give some advice to a young lady, young guy, a medical student, future nurse, he or she that is looking to pursue this career. What advice would you give them before you guys leave? Sorry to you, Dr. Sarah.
I think it's an absolutely rewarding job. I don't think there's any other career where people so honestly and passionately spill their lives, their deepest, darkest secrets to you and trust you with that information. It's a relationship quite like any other. And I'm very grateful every day that I get to share that with the people of Cayman.
Love it. Love that.
Yeah. I have not had many moments of regret from doing medicine. I think medicine changed hugely. And I'm sure anybody going into medicine, they will share that experience of it because of the research, the development, everything else that goes on. Now, I do speak to a lot of prospective medical students who are applying for scholarships and things. And the one thing I do is actually not talk to them, but talk to their parents, especially their mothers, and say, don't rush. Yeah, you can go through some very rapid ways of becoming, being a frontline doctor, especially if you go through US training. Don't. Take your time, do it properly. It's not just the undergraduate, it's the postgraduate period. Before you are a really good, well-skilled doctor who is safe, between medical school and postgraduate training, you're probably talking about 10, 12 years. So mums and dads, don't think your son or daughter is coming back to Cayman anytime soon, because you will not be doing them a favour and you will not be doing people in Cayman a favour. You need to get all that training and that experience in the best places you possibly can. Take your time, cram yourself with all that experience, and then we'll welcome you back.
Love it. Love it. Thank you so much, Dave, for all you do. And guys, thank you, ladies. Thank you so much for being a part of the program today. Have a wonderful day.